So today our topic of discussion is canine mammary neoplasm. Uh, have you seen this type of cases in clinics?
फोटो लगा हुआ है।
हेलो, आपने देखा इस तरह
No,
का
sir.
केसेस?
No, sir.
No, sir.
इस तरह का केसेस नहीं देखा आपने क्लिनिक्स में यहाँ पे?
मेरा जीमेल में लगा हुआ पहले बोल दिए।
सर अभी तक तो नहीं देखा था।
Okay, so today we have a class on this canine mammary tumor. So the canine mammary tumor is nothing but a tumor of epithelial cells of mammary gland, and this could be either malignant one, a malignant tumor we call is carcinoma, or benign one, in which we generally use the term adenoma, or sometimes there is a mix malignant or benign tumor, that is a complex adenoma and carcinoma, we call adenocarcinoma. Okay, and this one is the most common tumor of the female dog, and it is found in male also, but it is a very rare case in case of male. And whenever you get this type of tumor in male, they are mostly benign in nature. Okay, then next one is a 50-50 rule. That means if you see the whole tumor, the incidence of the whole tumor, the 50% of the mammary tumor masses are benign in nature, whereas 50% are malignant in nature. Okay, and out of 50% that are malignant, okay, 50% will reoccurs or metastasize following the first surgical resection. That means if you see the whole population or whole incidence of a mammary tumor, then 50% of the cases would be of benign in nature, and rest 50% is comes under malignant tumor, right? And out of that 50% that comes under the malignancy, within that the 50% of the cases is cured with a surgical removal of that tumor, but rest 50% will show the recurrence or metastasis. So ultimately, if you perform the surgery, 50% of this malignant tumor, 50% of this benign tumor, and half of this malignant tumor are totally cured by surgical excision. So there is a strong correlation between ovariostomy and mammary gland tumor. Okay, so if you perform the ovariostomy in the beaches before first estrus, then chances of occurrence of mammary tumor in future would be 0.5%. It's very difficult. People are not getting it. Okay. The next one is if you perform the ovariohysterectomy between first and second estrus, then chances of occurrence of mammary tumor would increase to 8%. And if you perform ovariohysterectomy between second estrus and 2.5 years of the age, the chances of occurrence of mammary tumor would goes to 26%. And but if you perform ovariohysterectomy after 2.5 years of age, the incidence would be as equal as 26%, and there is no benefit of performing this ovariohysterectomy once the animal crosses beyond 2.5 years of age. Okay, so similarly in case of cat, if you perform the OH or ovariohysterectomy at the age of 6 months, then you can able to reduce the incidence of mammary tumor by 91% in future. Similarly, if you perform at 12 months of age, then you can able to reduce the chances of occurrence of mammary tumor in future by 86%. And if you perform it after 24 months, then the chances of reduction of future occurrence in of this mammary tumor would reduce to 11%, right? So how it varies? There is a strong correlation between ovariohysterectomy and the incidence of mammary tumor. Okay, this slide is clear to all.
Yes, sir.
So if you perform the ovariohysterectomy in an early age, you can able to minimize the chances of future occurrence of mammary tumor. That is the point in this slide. So in nutshell, we can say a spaying or a variectomy before the first stress reduces the tumor risk by 200-fold as compared to the intact dog. That means if you have a dog in which you perform the OH before 6 months, and one same dog, same other dogs in which the OH has not been performed before first stress, then chances of occurrence of tumor in intact dog would be 200 times more as compared to the spayed one. That is a statement. Okay. So there are 5 pairs of mammary gland in dog, and counting we do from the cranial to caudal end. So this one is the first pair, second pair, third pair, fourth pair, and fifth pair. And we start counting from right first, right second, third, fourth, and fifth. Okay. So if you see the cases or incidence of the cases of mammary tumor, then you find that the caudal fourth and fifth, caudal first, second, third, caudal fourth and fifth. These last two glands are more frequently affected with the mammary tumor, and the reason behind this more incidence in this fourth and fifth is due to more masses of mammary gland, or we can say more mammary tissue in the caudalmost gland that predisposed for the higher incidence of mammary tumor in this gland. Now you see also in this case also you find this the caudal part, and here also you get the from the caudal limb. So next one is a clinical sign. So the clinical sign, you can able to see there is a growth from the distance, and second things that growth may be associated with the nipple or only gland itself. Benign lesions are always small, or most of the time that is a small, well circumscribed and form on palpation. And malignant tumors are mostly the more than 5 centimeters in size, and they show the tendency to develop the ulceration. But by this criteria, we can't definitely say that this tumor is a malignant one. You must go for histopathological evaluation, then only we can uh, confirm that this tumor is belongs to malignant one or benign one. Okay. Next one is a one unique type of this mammary tumor is inflammatory
सर सर
mammary. हाँ,
सर 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 ये ट्यूमर मेमोरी ट्यूमर को हम निकाल लेंगे फिर उसको भेजेंगे ना हिस्टोपैथोलॉजी के लिए, या कि मतलब इंटैक्ट रहेगा तो ही?
नहीं नहीं, आप मेमोरी ट्यूमर को रिसेक्ट करेंगे, इसके बाद हिस्टोपैथोलॉजी
यस
के लिए भेजेंगे.
यस सर, यस
ओके.
सर,
इसके बाद उसकी
यस सर, यस
आगे मैं नेक्स्ट क्लास में मैं डिस्कस कर रहा हूँ आपको. So one unique or we can say typical and most severe condition that comes under the mammary tumor is inflammatory mammary carcinoma. This type of tumor is very aggressive and characterized by the resemblance of this acute mastitis, edema, firmness, erythema, and painful condition. And prognosis of this type of tumor is also very poor. And this type of this inflammatory mammary carcinoma tumor is also not suitable for surgical removal. Okay. Then palpation of the lymph node. So whenever you suspect or if you get the presence of mammary tumor in a bitch, you need to palpate the regional lymph node also, whether that particular lymph node is enlarged or not. Okay. So what the common regional lymph node you have to palpate is inguinal, that is situated inner to the thigh, and axillary in the armpit, prescapular in front of the shoulder, and popliteal that is located just behind the knee in hind limb, and abdominal lymph nodes. This palpation of the lymph node will give you a clue about the metastasis or migration of this tumor in the systemic circulation, or metastasis we can say. Okay. So for diagnosis you have to take the fine needle aspiration cytology. But remember, with the help of fine needle aspiration cytology, we can only able to differentiate whether the condition, this growth of this mammary gland is due to inflammation, simply inflammation, or any infection or tumor. with the help of fine needle aspiration cytology, we cannot able to tell whether this tumor is benign or malignant one. So how we perform this fine needle aspiration cytology? We prick the needle in the tumor and aspirate or create a negative pressure in the syringe, and we prick 3 to 4 times in the tissue. Okay, and before taking outside from the tumor, or before withdrawing this needle outside from the tumor, we release the pressure and simply take it out. Okay, and next step is you detach this syringe with the needle hub, and again uh, uh, take care or in the syringe and attach with the hub of the needle and push it so that whatever the content that is present in the hub of the needle will drop on the slide, and you prepare the smear for further examination. And and another technique is we pull the piston of the syringe and we prick the needle before attaching to the syringe. Okay, and after pricking in the tumor, we attach this syringe and make at least 8 to 10 prick in this tissue and take it out, and simply you push that piston so that whatever the tissue that is accumulated in the needle will drop on the slide, and you can able to prepare this fine needle aspiration cytology smear. Okay, so by taking the fine needle aspiration cytology, we can able to differentiate whether it is a case of inflammation, infection, or tumor, but we cannot tell whether this is a case of benign tumor or malignant tumor, right? So for confirmation whether the tumor is benign or malignant, you must submit the biopsy after surgical. Next step for taking the biopsy is a core needle biopsy. In this case, we push the needle, we push this screw cut part inside the tumor, and after pushing inside, we slide the sleeve over this cutting edge and we can withdraw it. So after sliding the sleeve on this cut edge, again we have to connect because only 10 minutes is there. Okay, or do you have another class? Hello, do you have
Sir,
another
another
class?
class. Yes, sir. Yes.
Yes, sir. 12 p.m.
हाँ, तो within 10 minutes it will get disconnected. तो क्या करना है, दोबारा करना है इसको कंटिन्यू?
सर 12 p.m. पे क्लास है सर.
तो एक बार और कर सकते हैं हम आगे? नहीं कर सकते हैं, अभी कितना हो रहा है?
यस सर, अभी 33 हो रहा है सर.
हाँ,
11:33.
हाँ,
यस
कर
सर.
सकते हैं 12 तक सर.
हाँ, तो आप ये करना 11:55 में हमें बता देना, we can disconnect. Okay, so that you will get 5 minute time.
ओके सर.
और we can say 11:50 पे आप मुझे बता दो, so that you will get 10 minute time for replacement. Okay? ठीक है?
यस सर.
Anyone of you, just you tell me at 11:50. So that is a core needle biopsy technique. And next is staging. The WHO has a strict guideline for staging of this mammary gland tumor. So they have classified into 5 stages, and the higher the stages, the prognosis would be poor or worse prognosis. So under stage 1, the size of the tumor would be about 3 centimeter in diameter. There is no regional lymph node migration, okay, and there is no metastasis. Under stage 2, the size of the tumor would be 3 to 5 centimeter in diameter. There is no metastasis in the regional lymph node, and also there is no systemic metastasis. Okay. Third one is it's about 5 centimeter in diameter with no involvement of the regional lymph node, and there is no metastasis. And fourth one is a tumor may be of any size, but if it migrates to the regional lymph node, then it comes under the stage 4. And stage 5, tumor may be of any size, small or big, but it migrates to the regional lymph node, and also it shows the metastasis in the systemic circulation, via systemic circulation. Okay. So the higher the stage of under this classification, the prognosis would be poor. So this classification is mainly based on the size of the tumor and involvement of the lymph node, or we can say adjacent lymph node, or metastasis in the systemic body or body system, we can say. So that is this classification is based on this criteria. So other criteria is also there. So if you, after surgical removal of the tumor, if you put for grading or histological grading, then there are 3 histological criteria. On that basis, they give certain score, and ultimately they combined all 3 and put under the grading. So, tubule formation, nuclear pleomorphism, mitosis for 10 field. Okay, mitotic figure in per 10 field कितना हो रहा है, on that basis they put a score, and ultimately they count the whole score and they grade the tumor, and on that basis they also able to predict the recurrence of that tumor or death of the animal. So if it comes under the grade 1, the chances of recurrence is 3.4%, and the chances of death of the animal due to this mammary tumor is nil. If the tumor comes under grade 2, then the recurrence or chances of the recurrence of metastasis in future will be 15.8%, and death chances is 15.8% also. Here, I think by mistake they have written grade 2. This would be grade 3. Under this category, the chances of recurrence and metastasis in future after surgical resection of the tumor would be 58.8%, and death percentage is also higher. So this one is also the survival time for the canine mammary tumor, for the animal that is suffering from canine mammary tumor. So if the tumor diameter is less than 5, then the animal after surgical resection, animal will survive up to 1 2 weeks. If the diameter is less than 5, if it is more than 5, it's a 40 weeks. Lymph node metastasis, if there is no metastasis, then recurrence will be 30% after 2 years, And if there is a metastasis in the original lymph node, then occurrence would be increased up to 80% after 6 months. Similarly, the death rate is also, if lymph node is not involved, then death rate would be 21%, and if involved, it reaches up to 86%. These incidences I am talking about only those 25% malignant tumor which is creating problem. But 75% of the mammary tumor, simply we remove surgically, we can able to get 100% cure. Okay. So next one is a surgery. Surgery is the only choice except inflammatory mammary carcinoma. इन्फ्लेमेटरी मेमोरी कार्सिनोमा में इसलिए सर्जरी नहीं करते हैं बिकॉज इस ट्यूमर इज इन्फ्लेमेटरी इन नेचर. आप जो सर्जरी करोगे इसकी हीलिंग नहीं हो पाएगी, ब्लड क्लॉटिंग की प्रॉब्लम आएगी, एंड दैट इज इट विल क्रिएट पोस्ट ऑपरेटिव यू विल गेट सीवियर एडिमा and due to which your suture will get dehiscence. So there is a lot of complication. So generally this case, that is inflammatory mammary carcinoma tumor, is not a case for surgical removal, right? The treatment is only palliative. For this tumor, treatment is usually palliative and not curative. And supportive treatment we can give or treat with the pyroxicam, which is also shows the anti-neoplastic properties at the dose rate of 0.3 mg per kg body weight daily. So if you compare this inflammatory mammary carcinoma cases, or two cases, in one cases you have treated with the pyroxicam, and other cases you are not giving the medicine, then the survival rate of the dog which is treated with this pyroxicam would be 6 months, whereas it is 1 month when you don't treat this animal, if you compare with the non-treatment. Okay, it is clear? हेलो, वो क्लियर है ना? तो इसमें आप अल्टीमेटली
Yes,
आप
sir.
देखो, अल्टीमेटली you can see the 100% of the benign tumor can be cured with the surgical procedure, whereas 50% of the malignant tumor will respond to the surgery. So ultimately 75% of the mammary tumor can be treated with the surgical procedure, right? So if the lymph node is also involved,